Lyle Christensen. I'm from Eagle Grove, Iowa. I'm 81 years old, semi-retired farmer, and try and keep active and keep everything working as good as I can. I had my hip replaced, which was my second hip. I've had both knees, both hips, and my left shoulder replaced now. All of them right here by Dr. Li in Clarion. It's the greatest place in the world. Oh, I couldn't do anything. I couldn't walk. It was horrible. The pain was just unbearable. I mean, you know, it's just, you can't really describe it till you go through it. And you just have to, well, you just put up with it. And we debated about it. I'd thought about it a long time. Do I really want to go through it? This is with the first time, my first hip. But after the first one and after all the rest of them, I wouldn't hesitate. And I always tell everybody the same thing. If you've got joint problems, get to the doctor and just check it out. And be sure you go to Clarion and get Dr. Li. So, but and when you get done with it, the pain's gone. I mean, you wake up from anesthetic and you don't have any more hip pain. It's gone. It's crazy, but it's nice. And if it hadn't been for Dr. Li, I'd have been in a wheelchair now. I wouldn't even be moving. So, but now I haul all the grain in the fall for my son. And last fall I drove 1,250 miles in the tractor hauling grain to town. And I wouldn't have done that if I hadn't had that hip replaced. So, don't be afraid of it. Don't be afraid of it at all. I mean, it's really not that bad, but do your therapy. And if you do it beforehand, it's a lot better. Do it before and after. And mind what they tell you and do it. I've known some people that have it done and it comes time for their therapy. Oh, I can't do it because it hurts. And I said, do it anyway. I mean, that's how you're going to get better, and it will get better. It will. I'll guarantee you. And so I've had absolutely no problem with it at all. Don't be afraid of it. I mean, it's so good. And like I say, to get rid of that pain, I mean, you can't, unless you've got that joint pain, you can't really describe it. It really is bad. But as soon as you get done with the surgery, the pain is gone. And then you just have to work at it, getting your muscles back, toned back. But like I say, you get your knee done at 7 o'clock in the morning, by 4 o'clock in the afternoon, you're out of bed. And it's the same way with the hips. I mean, they don't leave you lay there. You get up and get going. And so it's fun. Well, yeah, it's fun. I try and make fun out of everything because, well, you have to. And so I'm just goofy. That's why my grandkids all say, Grandpa, you're weird. They all work together. I mean, it's not pulling apart. I mean, well, I've always said it's just like either working with a team of horses or a team of jug-headed mules. And these are horses over here. They work together. Jug-headed mules, one goes one way and one goes the other. And so it's just a team. It's just this terrific team. Like I say, I can't say enough good things. I could I could ramble on for hours. So, I guess to say how easy it was going to be, really, because you know, oh, you don't want to have surgery. Oh, it's terrible. Oh, the pain. It's not terrible. And like I say, it's such a blessing because when you come out of the anesthetic, your pain is gone. I mean, you have surgical pain, but you don't have that excruciating hip pain or knee pain or shoulder ache. Well, one of the, for instances, and it's not about this hip, but the shoulder I had replaced was so bad that in order to get my arm up on the table, I had to go like this and lift it. I couldn't even move that arm. It would just hang down. And Dr. Li told me, he said, well, now, when you get it done, if you can get your arm up that high, he said, that's 100% success. So I came back to see Dr. Li, and he says, how high can you get your arm? I said, is that all right? And he about went nuts. So, I mean, you get what you make out of it. If you want to be an invalid, you can be an invalid even after you have your joint replaced. But life is too short. Have a good time with life, and get them, get your joints fixed. Why put up with that pain and all that inconvenience when it's nothing to it? It's in the middle of the night when you can't sleep, because you can't sleep, and I never could sleep in the hospital, and the nurses will come in and they'll sit there and they'll visit with you. And the nurse's aide came in with the nurse to adjust my bed and stuff, and my feet were sticking out from under the covers, and I wiggled my toes, and I said, "Hey, Cookie, look at there, my toes are better, they're able to be out." And she went down the hall just laughing her head off. I thought that was the funniest thing. So I usually try and have fun with them, and they'll have fun right back with you. And just go for it, man. It's just, you can't beat it. Yeah, it's just been phenomenal. I mean, there's just, they treat you just, well, like you're one of the family. The nurses get along, you don't hear any arguing, and it's, some of them, like I say, I've been in Mason City, Ames, and Des Moines, and you always get this bickering between the nurses and the aides and stuff. There's none of that over here. I mean, this hospital it's just perfect. And Dr. Li and his associates are all just perfect. And Dr. Li, I've never seen that guy when he was not smiling. I mean, I don't care how bad a day, and he's smiling. I could tell a couple stories on him, but I probably better not, so I won't. You don't know what's coming, and you think, boy, I don't know if I'm doing this right or if I should be just putting up with it. And but like I say, I wouldn't advise anybody. I would say, if you need something like it, go for it.